Hi, I'm Brian Mandel, the editor-in-chief of the Cleveland Clinic Journal of Medicine, CCJM. Welcome to Beyond the Pages, CCJM podcast, where we will take you in depth into the content of selected articles from the Cleveland Clinic Journal of Medicine and explore a few interesting tangents along the way. Through moderated interviews with our authors and other experts in the field, we hope the clinicians will gain a more nuanced perspective of clinical concepts that are changing the practice of medicine and be able to apply this perspective to the care of our patients.
Welcome back to part 2 of our conversation. Please be sure to listen to part 1 of this episode. Now, let's go back beyond the pages. When we think about patient care, patient privacy issues, HIPAA issues, always come to mind. Are there certain legal or HIPAA issues the audience should be aware of?
So these models are very complex. They have to be running in the cloud, and the cloud is just a fancy way of saying someone else's computer. So patient privacy is definitely a concern. So ChatGPT, the website itself, it's not HIPAA compliant. So don't enter protected health information onto the platform, right? Or any other publicly available services. If you want to do charting and clinical summaries, you need to wait for the commercial services to come out. And it's probably going to come much faster than you think. There's also a few HIPAA compliant companies that are doing similar things to ChatGPT that you can try. But again, don't use any of the public systems. And if you want to use the model for diagnosis or for answering medical questions, there's also the question of liability, right? So if something goes wrong, who's at fault? At the time of the recording, I don't think there's any large language model that has received FDA approval or FDA clearance for using patient care. There are some new frameworks and policies that are being worked on for large language models. But right now, if you use a platform like ChatGPT, you will be held responsible for still adhering to the standard of care, right? It's like if you did a Google search for treatment advice. Google is not going to be responsible if you got something that is incorrect. It's your job to vet the information that you have. So if you use ChatGPT and something goes wrong, you could be held liable, right? The exact liability may need to be a court case issue, but let's just hope that we don't get to that point. But if you just want to, proofread emails, or if you want to translate consent forms, ChatGPT should be okay as long as there's no patient information involved.
Okay. How do you think medical schools and residency programs should prepare their trainees for ChatGPT or artificial intelligence, the future of medicine? What steps do we need to take?
So as a medical student myself, I feel like medical schools in general, they don't have a huge focus on health informatics and health technologies. I think that we do need a greater focus on AI because it's going to be very relevant for practice in the future. It doesn't have to be anything that's too specific, just a general overview of what they are and how they work, kind of like what we did on the podcast today. We should treat it just like any other medical devices that we use, right? Just like how we teach students about x-rays or like how ventilators work.
Yeah. Now I know things. Yeah. Anthony, please.
Yeah. So right now there's an emphasis appropriately on teaching our medical trainees and staff on statistical methods and everything they need to critically appraise research articles. We need to know if new evidence is published, is it something that we should incorporate into our practice? Now, as more and more medical research is being published that uses machine learning methods, whether that's classical machine learning, deep learning, or large language models, medical students and physicians should be familiar enough with the methods in order to critically appraise these articles. Right? And so I think there should be initial training in AI at the medical student level, even if it's just to familiarize themselves with topics so that one, they can just be comfortable with the medical literature that's coming out and understand it to the degree that more traditional methods are understood. Secondly, to do AI research itself, you need two different groups of people. It's multidisciplinary research by nature, and the two groups you need are the people in the medical profession who are known as the domain experts. We know something about our patients, the disease, the pathology, the trajectories. And then you have the computer science who provide the coding expertise. The more that our medical students or physicians understand how these models work, what data they need, the the more overlap between these two teams, the medical experts and computer experts, the more that this research can be successful. So I do think there should be teaching in AI for our medical students and residency programs.
Wonderful. Thanks for sharing those thoughts. Now, I know things are rapidly changing, but if you take a look 5 to 10 years in the future, what do you think are some longer term applications that are on the horizon that we've not talked about today that physicians should be aware of?
So I'm kind of imagining, if we have a large language model that can retrieve information from a platform like UpToDate, right? So it's kind of like the Perplexity model that Anthony was talking about earlier, where it pulls results from a search engine, but it uses UpToDate as a backend. So if I can ask a really specific medical question, and if the model can give me a summarized guidance from UpToDate without me having to dig into the website for 20 minutes, that would be groundbreaking. I think we already have a lot of proof of concept in this area. Like, it's not far-fetched at all. And as somebody who's going to clerkship really soon, I would pay anything to get my hand on something like this.
And I think that in the landscape of AI, 5 to 10 years is a really long horizon. Okay. There are many large language models currently available, GPT-4 perhaps being the most common, but there's Llama 3, Claude 3 by different groups. And when people have published on what the groups that produce these models are looking at for the next iterations, GPT-5, et cetera, these groups are thinking of using 100 times the current training data, 100 times the current compute power, and similarly more electrical power to power all this. And so we're going to soon see the answer to the question, is it all about scale? If you just have a few orders of magnitude more data, how will the performance of these models increase? So we'll see that. And while these large language models are generally, but not exclusively limited to text in and text out, soon we're going to be having multimodal models, more of them, where you can put in text, audio, or video and get back any other type of modality. So there's going to be continued advancement in all of these models, and they're going to go beyond just text soon.
Wow. So if someone's interested in trying to stay up to date with this ever-changing landscape, are there particular resources that you would recommend for our audience?
So we listed a few resources in our CCJM paper. So there are some really good podcasts like NEJM's AI Grand Rounds that are focused on artificial intelligence. But in addition to those, I think it's like Anthony mentioned earlier, clinicians need to learn a bit more about the basics of how the algorithms work. Maybe not as much for language models, but definitely for the more traditional image and number-based tools that we talked about. So I think the American Academy of Family Physicians and AMA, they both have online courses in AI that you can take for CME credits, which I think is great for this purpose. And a lot of the major universities in North America and a lot of the specialty societies, they now all have some sort of CME course focused around AI. So those are what I would encourage clinicians to look into.
Great. Well, as we wrap things up, I wanted to make sure I gave you both an opportunity for kind of a last word. Are there any other items or topics that you think it would be important for us to mention before we end our podcast?
So for me personally, I think there's a lot of hype surrounding large language models right now in medicine. I don't think the hype train is going to stop anytime soon. People still dream of having some kind of AI assistant or AI chatbot that can help out in the clinic. The thing is, large language models, they're very good at mimicking intelligence and sentience, but they're just not good enough for anything beyond charting or notes just yet. Right? So there's going to be a lot of studies that are coming out in the upcoming months, and most of them will just be uploading patient cases onto ChatGPT and logging the diagnostic accuracy, right, without doing anything else. We're going to see a lot of these types of studies. A lot of them, they're going to conclude with, it's not very good right now, but if this technology keeps improving, one day it's going to play a more active role in diagnosis and prognosis. I think the issue is that, to use an analogy, it's kind of like doing a study looking at the efficacy of using butter knives for doing surgery, right? I'm sure you can do it if you're really motivated. And if that technology improves, it'll be much better for surgery. But at the end of the day, it's still the wrong tool for the job that we're trying to do, right? It's just a language model that's designed to work with language. We have a lot of other tools like numerical and image-based tools and search engines that just do a much better job at diagnosis, prognosis, and getting accurate medical information. So I think that physicians should not be overwhelmed by the hype that we have right now. When they read a research article about ChatGPT, they should keep in mind how this technology works. They should keep in mind the technology's limitations. And of course, they should always be looking out for research on more traditional and less flashy forms of AI, like the number-based calculators and image-based models that we talked about, because those are going to be the models that's going to play a larger role in clinical practice in the future.
Absolutely. And I'll end by just talking about, I see the promise of AI leading into prospective multi-center studies. Currently over 95% of the published machine learning research uses retrospective data and it's single center. To truly have breakthrough prognoses and diagnostics for our patients, we're going to need multi-institutional prospective data. The higher quality of the data, the better quality of predictions from your algorithms. And to me, that's extremely exciting. Looking forward to collaboration with multiple centers in the future, to designing the best algorithms, having best data for them to train on, and then really seeing where we can bring our patient care into an era of individualized precision medicine.
Thank you so much. I really, Anthony and Fred, I really appreciate you taking the time to be with us today. I would encourage all our listeners to read their wonderful paper in the Cleveland Clinic Journal of Medicine, again called Artificial Intelligence in Clinical Practice. Thanks again. Really appreciated all your insights today.
Our pleasure. Thank you for having us.
Thank you for your insights in helping us to go beyond the pages of the Cleveland Clinic Journal of Medicine. To read CCJM articles, visit ccjm.org. To participate in other accredited educational activities, visit ccfcme.org. You can subscribe to the podcast on Google Play, Spotify, or however you prefer to access your podcasts.